Hi everyone, this is Nicole and we're going to talk about the VASC band radial band removal from our cardiac cath lab patients. So first thing before we go and we start moving air, we want to make sure that we have our syringe. This syringe is a Luer-Lock. We could use any other syringe that we have, like our normal 12cc syringe, but the good thing about this one that comes with the patient is that this has a mechanism that you can lock. So we twist, this is open. If we twist back, it locks. So we want to make sure that we're taking out the most appropriate air that we're supposed to be doing per protocol. So having it on that locked setting is a good tool to have. So as we go to our patient, we want to make sure that we're assessing before we remove the air. We want to try and feel that radial pulse, distal to the site. So we want to feel that pulse, make sure that we have a good pulse there. We want to go and look at that ulnar pulse too, so we can feel on the other side. We want to check the sensation our patients are having in their fingers, make sure that they can wiggle them, the color in their hands, making sure they have their capillary refill. As we go to remove, making sure our lock is on, we're going to have no air removed. It screws on, and that pushed out 2 cc's of air, if you can see. The moment I screwed that on, it automatically pushed that 2 cc's of air out. You'll be able to see where the insertion site is, if there is any blood return or any oozing from the site. I'm gonna unscrew it, and then I'll come back in my 15-minute check, making sure that the pulses are good, the patient has their sensation in their fingers, the color, and also looking at the site before I remove any more air. Okay, so we're back with our 15-minute check, and I noticed that my patient has oozing underneath their band here. So before we remove, we're gonna check our pulses and our capillary refill and our patient's sensation, but we also wanna make sure that the most important thing is to take care of this bleeding here. So a few things may be happening. If there's no swelling happening proximal to the site or down here distal on the wrist, then we know that it's just an ooze from that site, and we may need to put the air back. So we're gonna go with our locked syringe. We're at the 2 cc's, right? Because we just took 2 cc's out. We're gonna put these 2 cc's back. We screw it in, and we're gonna push that air back in. We then make sure the patient still has a good pulse, radial pulse. We check our ulnar pulse. We check our fingers, making sure that there's no tingling sensation, and we check the color and the capillary refill. If that's all good, then we'll wait again another 15 minutes and we'll do the whole step again where we go to remove that air we put back in.